My name is Abby Brown, and I'm a JA mom, and I'm going to be your session host for today's session. Our moderator today is Robin Abri, who is the Director of Patient Education for the Arthritis Foundation. Welcome, Robin.
Hi, everyone, and thanks for joining us today. I'm very excited about our guest experts. I know that we're going to learn a lot about non-drug and complementary therapies, and I'm really thrilled to introduce both of our hosts today. Our first guest is Dr. Scott Schwantes. Dr. Schwantes is a board certified by the American Board of Pediatrics and the American Board of Hospice and Palliative Care. He is also a fellow of the American Academy of Pediatrics and a fellow of the American Academy of Hospice and Palliative Medicine. He has dedicated his career in medicine to treating and preventing suffering in children. His approach to patient care is holistic, and he combines his experience in medical acupuncture to enhance his traditional medicine training. Our second guest is Dr. Bethany Ann Kay. Dr. Kay is a family nurse practitioner at Children's Minnesota Hospital. She received her master's in nursing at Loyola University in Chicago and her doctorate in, I butchered that, doctorate in nurse practitioner at Concordia University in Wisconsin. She has an interest in complementary therapies, including essential oils, and is a certified aromatherapist. Welcome both, and I just want to let our guests know today that any questions you may have, you can direct to the Q&A portion of your screen, and we will make time for any questions at the end of this session. So I'm going to turn it over first to you, Dr. Schwantes. Welcome.
Thank you so much, Robin. And actually, I wanted to say a heartfelt thank you to every one of you who are joining us today for looking at additional ways to helping treat pain and suffering in children with juvenile arthritis, especially using the non-pharmacologic approaches that we're going to be covering today. Next slide, please. Both Bethany and I have nothing to disclose. Next slide. Okay, Bethany, if you'd like to introduce yourself again above and beyond what Robin had to say.
I'll just say a quick hi, and thank you so much for having us here today with you.
Thanks, Bethany. Next slide. And this is just a little bit of the other information on me. Thank you again, Robin, for that lovely introduction. I do actually invite you guys to send me an email if you do have questions following the presentation. If you do, however, please make sure you put a little bit of information like, hey, I was at the conference on Sunday, just had a follow-up question. Next slide, please. Okay, so we're going to go through this fairly quickly because both Bethany and I want to make sure we have plenty of time for Q&A at the end. But I just want to put this in a little bit of an environment as to say, what happens when you have an appointment with a pain doctor? That's what I do. That's what my clinic is all about. When I construct a plan of care for my patients, I do so outlining everything that you see on this slide. I make sure I think about what kind of medication should we be using, including such things as acetaminophen, as ibuprofen, as celecoxib, as well as if the situation warrants it, what kind of opioids might I use? And of course, if I do prescribe opioids, I always worry about opioid-induced side effects. We might talk about regional anesthesia. This would include such things as an epidural, some sort of a nerve block. We talk a lot about adjuvant medications to try to help kids feel better. But very, very importantly, in what we're covering here, I would be a very poor physician if I did not include non-pharmacologic therapies as part of my plan of care and how to take care of kids going through pain and suffering. We also make sure we include family support because we know it's not just the patient that we're taking care of, but they come in with their entire family. We have to make sure the entire family is as healthy and well adjusted as possible. So again, it's a fairly robust plan of care, and what we're focusing on here during this conversation today are some of those non-pharmacologic therapies that we might be mentioning. Next slide, please. So what really is going on with complementary and alternative medicine? This is also pediatric integrative medicine, as we so like to call it. A lot of this is really taking the mind-body connection, saying, how do we enhance this? How do we really focus on this holistic approach to a child's well-being? It's, like I said, really about taking not just the disease burden, but promoting that health and wellness of the child too. How can we actually keep them in that state of healthy well-being? There is definitely a therapeutic relationship. That's why we established this care. That's why we actually work together in that element of relationship. very much so, we use evidence. This isn't just, shooting from the hip. We use evidence because we want to have that information informing our decisions when we're doing a data-driven plan of care for our children. And we consider all the therapies that may or may not be appropriate. It's a well-rounded, thought-out process that we will use when we recommend these types of therapies. And Pediatric Integrative Medicine, or CAM, is supported by the National Institute for Health, and they spend plenty of money to make sure that we're developing as much evidence-based education and information that we can around pediatric integrative medicine. Next slide, please. And it's used quite a bit. This is a shot from our clinic. We find that nearly 1 out of 5 children are using some sort of complementary therapies. And then it's also, over the past 5 years, we see that's around 10%. The common uses that we see are for back or neck pain, for colds, anxiety, stress, ADHD. And then we use a lot of supplements, non-vitamins, non-mineral supplements. We use manipulation, that's more along the lines of chiropractic. And we promote a lot of movement in our children too. And this has been increasing with children who have chronic illnesses. So definitely our population that we're working with today with you guys, this is a highly prevalent form of intervention that we can use on behalf of the well-being of our children. Next slide, please. We worry about risk. We definitely want to make sure that we're using safe interventions and that we're giving you good advice because we don't want to cause harm. It's kind of that whole part of the Hippocratic Oath. We want to make sure that we say, this is not a replacement for your ongoing regular care by your team. We do not want to divert from any sort of necessary treatment. We also, like I said, want to use evidence-based interventions as much as possible. And we also make sure the child is involved. Children under the age of 18 cannot, definitely, they don't have that ability on their own, but we want to involve them at the concept of assent, not consent, to make sure that they're on board with what's going on with their own bodies. And we also have to include the risk-benefit ratio, which we'll cover a little bit in the next slide, please. A lot of our therapies may not have an abundant amount of evidence. When we look at medications that go through the FDA, we have ample evidence on the efficacy and harm that they might cause. So when I think of complementary and alternative interventions, I often will reference this 2 by 2. So is it safe and is it effective? So if we know it's safe and we know it's effective, clearly we're going to recommend that. However, if we know that it's effective, but we don't know that it's safe, we're going to have to monitor that very closely. An easy example of that is chemotherapy. And then definitely if we know it's safe, but we have no proof that it's effective, we'll consider that. We'll talk about, well, if it's low risk to your child and it might confer benefit, let's talk about what that would look like. Then definitely, if it's neither proven to be safe and it's not proven to be effective, we're not going to be recommending those therapies. Next slide, please. And again, this is complementary. We're not competing with the regular approach to medical therapies, and we in no way want to replace them. Ideally, we would reduce the burden of those other therapies, but we are in no way replacing them. Next slide, please. And Dr. K.
So I think the basis in integrative medicine quite often is breath and breathing, and teaching our kids, our patients, our families breath work. I think we all know that life is hard enough, and adding on top of that a medical condition only makes things more complicated. And so breath can just be a really good way to focus, to center, to help relieve symptoms, anxiety, stress, nausea, or even if you are taking pain medications, a good way to introduce a non-pharmacological strategy while you're also using different medications. Next slide, please. I like to show this more to my teenage young adult patients, just explaining how in diaphragmatic or relaxation breathing, how the vagus nerve runs essentially underneath our diaphragm. And when we really induce that belly breathing or deep breathing, it stimulates this vagus nerve, which can then help decrease our heart rate and really promote this relaxation response. Next slide, please. I think it's important, especially in children and young adults, that you make sure that our breathing tips work for them. So when you're teaching breathing or when you're doing breathing with them, to adjust to the rate of what they're doing. I think something that happens a lot is, often if you have someone that is maybe anxious and we tell someone not to be anxious or not to worry, that definitely doesn't help, and at times will make it much worse. And so I think of breathing very similarly. If I'm seeing someone, I'll often try to mimic my breathing. So you may see me maybe breathing a little bit faster and then slowly adjusting that breath to hopefully a comfortable rhythm that then is mimicked before you even teach it. And when I teach breathing, using words like take a nice comfortable breath or an easy breath or breathe a little deeper, and using words that can relate to and sort of promote that sense of relaxation and calm. Focusing on a point in a breath cycle can be very helpful. So can you feel that air entering your nose, or feel that air inflating in your lungs, or watching your belly rise? Sometimes if you have pain or stress, you can say to breathe in comfort, breathe out pain, breathe in relaxation, breathe out any stress. A little tip I also like, just where starting where the child is and gradually changing, you can do this with music as well. So having music with more of an upbeat beat to match a mood, to slowly a more moderate beat, to then even a calm, soothing music is another great way to help just promote calmness and relaxation. Next slide, please. With kids, it can be really great to use different things to help with breathing. So in an infant or someone with severe cognitive disabilities, you would do rocking breathing, which just looks like having a child or an infant on your lap against your chest, and just yourself practicing that deep breathing so that then they could mimic it. With toddlers, it's all about props. So bubbles, pinwheels. My next slide will show a few more examples of those. With children, there's a lot of different apps you can use that we'll talk about, or the belly breathing. You can do a lot of imaginary, so smelling roses, blowing out like you're blowing out a balloon. This Overman sphere kids just love. It's what's in the picture here. And so you can expand it as you take a deep breath and then also put it back in. I like to also, for my own personal fun, see how long it takes for a child to put that over their head. In our teenagers, we can do more complex imagery. This is also where a lot of different apps can come into play. This is also where you can start to introduce meditation or mindfulness. And also, I think it's really important that everyone in the room do this breathing together. So I always encourage parents, one, to do it for themselves. Again, having children can be hard, but having children with frequent medical appointments or needs can be even harder. And taking deep breaths throughout our day can just help with centering and focus and calming. And just doing that with your children can really also encourage the habit. Next slide, please. This is just an example of different props you can use for kids. So something you can do for belly breathing is if you place, in this picture, it's a duck, but a stuffed animal on the belly, and see if they can get it to rise up and rise down. Bubbles, pinwheels. The bottom picture is just an example of the rocking breathing, which you can mimic. Feathers, Kleenex, apps. You can get pretty creative with this. Next slide, please. I did want to just do one little breathing exercise with us all together. And so I'm going to ask that everyone just do this, which is just to get comfortable where you're sitting right now. Take a deep breath in to the count of 4. We'll hold that breath for the count of 7. And then a long breath out, trying to make it to the count of 8. And we'll just do 2 more. So deep breath in on the count of to the count of 4, holding to the count of 7, and out. And last one, in for 4, holding that, and a deep breath out. Great. Next slide, please. This slide is just to show you there's many different ways you can teach children to breathe outside of the just breathing in or breathing out and the belly breathing. The 4, 7, 8 is what we just did. 5-finger breathing is just counting on your hands. So for kids which are a little bit more fidgety, you can have them trace their fingers. Deep breath in, out. Square breathing is just holding in, out for the exact same count. Next slide, please. As Robin mentioned, I'm also a clinical aromatherapist. And so aromatherapy is the use of essential oils that essentially we get through distillation from different aromatic plants. It has different effects psychologically as well as physically. We can use this for physical and emotional symptoms. So some great examples are pain, nausea, vomiting, insomnia, anxiety, but also just to create in general a healing environment. It can be used in the home. It can be used in school. It's actually very often used in school these days. Can be used in the hospital, can be used when you're on the way to appointments, just lots of different ways of using it. I think it actually works really well with some of this breath work we just talked about as well. Next slide, please. So I'd just like to start, I guess, with this graphic. So what I really think is really cool about just our sense of smell or aromatherapy in general is, as you can see in this, it talks a little bit how if you smell something, how it goes through your nasal cavity into your olfactory bulb. But I think the neatest thing about the sense of smell is that there's a direct connection into the limbic system of our brain. The limbic system of our brain is responsible for our memories and our emotions. And so that's why smell can be so powerful, because you can smell something that'll just instantly bring you back to a moment in your childhood, for better or for worse. There's actually been recent studies in patients with Alzheimer's and dementia where they put one scent, say orange in the kitchen, lavender in the bedroom, lemon in a living room, and the thought that through sense of smell, they can be aware of surroundings. Different ways to use essential oils. Externally, you can do it through massage or compresses, in bath water, or inhalation through steam and diffusion. We're mainly going to talk about inhalation today. I think it's one of the easiest ways to use aromatherapy or essential oils. Next slide, please. So for inhalation, we don't do this much, but you can do it with moist. So in a steam bath where you essentially just do steaming water, a few drops, and put that over, it can be great for sinuses. Most often we use simple diffusion, which is just a few drops of essential oil on a cotton ball or a tissue, or a spray bottle, which we'll talk about, or diffusers. I'll just explain some of these pictures. So the picture on the bottom left is a aromatherapy inhaler. And so essentially what you do is you take that cotton wick pictured, place aromatherapy on that, and then place it within this cylinder. But then you can just take the cap off of, and essentially works as patients can just smell it, carry it around with them, fits in their pocket. Something that's becoming a little bit more popular is the second picture, which is an aromatherapy patch. You essentially just put a few drops of aromatherapy right on the middle of this patch, and then it'll stick to a gown or clothing. You can do the exact same thing with a Band-Aid. It's a much cheaper version. And putting some aromatherapy directly onto the Band-Aid, and you can place a Band-Aid on clothing or on your skin. I think a Band-Aid can be really great for kids. They can put it on even an undershirt, have it close so that then they can smell. They're even making necklaces or bracelets that can hold some aromatherapy. The next picture is just different spray bottles. So you do, aromatherapy or essential oil in that with water, just shake it and you can spray it. And then I think classic diffusers, which we've all seen. Next slide, please. I just wanted to go over, I'm going to do these next few slides pretty quickly, more for reference, but just some different smells that have been studied to help with some more specific symptoms. So anxiety and stress, lavender, lemon, Roman chamomile, and sweet orange. Next slide, please. For insomnia, lavender, lemon, sweet orange, Roman chamomile, and bergamot. Next slide, please. For nausea, we often use fennel, ginger, spearmint, and peppermint. Next slide, please. In pain, you'll often see lavender, lemongrass, peppermint, Roman chamomile, and rosemary. Next slide, please. In kids, I like to say it's best for aromatherapy to keep it simple. At Children's Minnesota, we actually did a study where we took 100 children and their families, and we had them smell 22 different essential oils. And what we found is that people tended to gravitate towards these 5, which is sweet orange, lemon, lavender, peppermint, and spearmint. Again, I think it's easier to keep it simple, easier to teach nurses, kids, families with these. Sometimes you'll have different preferences, which we're happy to arrange or order, but you'll also see the different categories and what each of these can do. In general, though, the thought is whatever you like and whatever feels good or smells good to you is what we like to use. I'll also say in babies or smaller kids, we don't generally go right to essential oils in this way, rather aromatherapy by smells that are comforting to them, which is often their parents' smell or comfortable objects from home. So like a blanket from home or a pillow from home. So anytime, if you ever have to have a child in the hospital or even at appointments, bringing something from home that smells like home can be so helpful to create that healing environment. Next slide, please. I'll turn this back over to you, Dr. Schwantes. Thank you.
Thank you very much. Okay, this is just my introduction to acupuncture. Again, I want to go through this quickly so that we can make sure that you understand some of the points of acupuncture and acupressure and be able to use those. Next slide, please. This is just essentially the nut of what acupressure is. So it uses the body to heal itself. We use our fingers to stimulate that point, and that allows us to pretty much take it anywhere we need to. Next slide, please. Acupuncture works, my sort of canned little elevator speech is by stimulating precise points along the body. We promote the smooth flow of chi or energy throughout the body to return it to a state of balance. And that's really what we're talking about, is using the body's own ability to heal itself. Next slide, please. So acupressure, again, this is helpful for a number of things. And again, you can bring it with you. So it's wonderfully applicable in any situation. Next slide, please. Safe and effective, and there are really no side effects. Next slide, please. How we do this is you apply gradual steady pressure. You come in at a 90-degree angle. You apply and release gently. You don't just jab it right in. We use the middle finger because it's usually the strongest, and then we can use our other fingers to kind of prop it up if we need to. We generally say you can do it for up to 3 minutes at a time. Next slide, please. Obvious stuff, please don't do acupressure over a big burn. That would not be a good idea. And we don't recommend acupressure or acupuncture in women who are pregnant. Next slide, please. So these are the common points for pain. Pericardium 6, large intestine 4, and governor vessel 26. I'll show you where those are in a minute. Next slide, please. For nausea, pericardium 6, and then we use the Korean hand acupuncture point, K9. Next slide, please. Anxiety, we'll love to treat anxiety. There's a few points there that we'll go over. Next slide, please. Okay, large intestine 4. This is a great one for pain. And it really is that spot right there, kind of the meat in between where your thumb meets your index finger. Is a great spot to stimulate. I'll often kind of say you can grab both of them at once and just kind of press, but it's also you can just kind of grab right in there. So although we'll tell you to kind of do the pressure like this is one that you can do easily just by grabbing right in there and pressing right down. And that one is a wonderful one for pain. So it can really relieve that wonderfully and is a great one to stimulate whether you're having a headache, joint pain, just go for Li4. Next slide, please. The other one that we really like to use commonly is pericardium 6. Most people are aware of this one. This is a common one for nausea, and they'll treat it with C-bands. They usually use the wrong spot though, because they'll go right at the crease of the wrist like it's a bracelet. It actually needs to go 3 finger widths down the forearm to get to the proper spot. So that's the real big secret about that one. There are the 2 tendons that run down the wrist and forearm. You want to get right in between those 2. So again, 3 finger widths of your finger. So if you're using your child, use your child's fingers. And then that's the spot right in between the tendons. So again, that's where it is, not up there. Next slide, please. K9 is a great one for nausea. It's on your ring finger, and it's just in that spot there in that middle phalange, not the tip, not near the hand, the one right in the middle, and that's K9, and it's another good one for nausea. Next slide, please. Good one for anxiety, right here on the philtrum of your lip, right between your nose and the top of your lip. Just push down on that, and you can just kind of push it right into the top of your jaw. Next slide, please. This one works wonderfully for children. It also works for just kind of helping the little ones calm down, get them to sleep a little bit too if you're trying to rock a baby to sleep. But it's really in that smooth spot right between your eyebrows, not down on your nose, but just that smooth spot right between your eyebrows. It's a good one that you can stimulate for anxiety, governor vessel 24.5. Next slide, please. Heart 7 is on that crease of your wrist, and it's just right out here by your pinky. And so if you kind of slide out, you kind of just drop off. So you don't go all the way off the edge, you just kind of slide. And right before you were to fall off, there is heart 7. And that's another good one for anxiety. Next slide, please. And now back to Bethany for some helpful apps.
Sorry about that. I think in today's world, it feels a little bit like integrative medicine should be moving away from technology and apps, but that's not where we are. And so often teaching apps and things people will really utilize can be so helpful. So I'd like to just go through a few go-tos. Next slide, please. Yeah, so Stop, Breathe, Think is a really good for kids under 12. What I like about it is more of an active breathing, active meditation. So essentially, this is what it looks like on the right when you open it, is to find a mission or see all missions. So if you were to click find a mission, it would lead you to I feel, and you essentially click a face on how you feel. And what I really like about this app is that, you know, we can feel multiple things. So when you click even a smiley face, it can say, do you feel, you know, still like a happy, content, playful? It gives us lots of different options. And then based on what you pick, it'll give you, as you can see in the bottom left, a different mission. So what we see here is a body scan, counting breaths, and it tends to keep kids more engaged. Next slide, please. Breathe, Think, Do is essentially its sister, but the Sesame Street edition is really good for kids under 5 to teach breathing. Adventure of Super Stretch is again another active one. Essentially, you click one of these animals and it'll do a breathing exercise with you, as well as different yoga poses or mindful movements. Next slide, please. I think these are ones we all hear a lot about, Headspace, Calm for Kids, and Insight Timer. I will say first is that I wouldn't pay for any of these. Their free versions are all very good, and there's just so many out there that I always tell people not to pay for them. I feel like Insight Timer is not one that people hear of as much, but I will tell you it's my personal favorite. What I like about it is it has all the features of Headspace and Calm, where you can click on different stories or different adventures. But Insight Timer has a search feature, so you can say, I feel anxious right now, or I feel tired, my stomach hurts, my knee hurts, and it'll have a very specific meditation for that. But it'll also say whether it's somebody talking you through it, whether it's with breath work, whether it's with music, and it'll also list how long it is. I think often what we try to do is we say like, oh, meditation's a great idea, and then we click on like a 30-minute thing to do, when really not many of us could just jump right into 30 minutes. And so with Insight Timer, you can do it for 2 minutes, 6 minutes, 60 minutes, but I always suggest starting at 2 minutes is a great place to start. Next slide, please. I won't read through all of these for you. I think there's 2 or 3 slides that look just like this, but I wanted you to have different options with different age ranges of some of the apps we really do go to. I will say something we do at Children's Minnesota is any child who's in the hospital or in the clinic can rent an iPad. And on that iPad, we've preloaded them all with 10 to 20 of these different apps, which they're probably a little bummed when they open it and they're looking for games and it's just mindfulness apps. But it's good, I think, to have a variety of options, and so that they can click around and play with it and find what works for them. Next slide, please. Again, just more examples of different apps that can be good for kids with the ages. And as you'll see, almost all of them say free. Again, there's so many out there, no need to pay for them. Next slide, please. I did just want to include this for reference. This is a pediatric integrative medicine flyer. It's one that we use at Children's Minnesota. All of our nurses, all of our physicians have this, and it goes through just a simple introduction to diaphragmatic breathing and how to do that with your child or with a patient or actually with your whole family. Different aromatherapy, abdominal massage, and then just relaxation mental imagery. So how you could get into starting that with your child. Next slide, please. Thank you all for being here, and I'm pretty sure our next slide, which we can go to, says questions, and we're happy to take any questions you have. Thank you again for having us today.
Thank you so much for that wonderful presentation to both of you. I just want to remind our audience that we do have the Q&A function if you have any questions, but I'll just start off by asking, if you're interested in trying CAM therapies and you're not so sure about how to approach them to your doctor, what are some good talking points to let your doctor know that you want to try these and get the ball rolling on that? Because I know sometimes there may be a little bit of resistance with alternative therapies.
I'll say, just from the physician perspective, I appreciate a family coming forward to me and saying, hey, I'd like to look at some non-medication ways to help my kid out. And I think that's a wonderful way to just kind of broach the topic. And if that physician themselves isn't comfortable offering or advising on that, they should hopefully be able to make a recommendation to say, like, well, maybe I don't have those answers, but my colleague Bethany does. So why don't I set you up with a visit with her? But that's, I think, a nice, easy way to just, and I mean, most of us in the classically trained physician way, if we hear a family come to us and say, I want non-medication ways to help my kid feel better, we're going to be responsive to that. So that's a nice icebreaker, as opposed to coming in. You can also do this. I have no problem with that. But for some folks, it might be more intimidating if you have a list of saying, I want to look at doing these things for my kid. How can I do it? Be like, okay, wait. So I think an easy icebreaker, like I said, from the physician perspective, to say, hey, I want to do some non-medication ways to make my kid feel better. What would you recommend? Bethany, do you have other thoughts?
No, I just think it's important to say that, you can do both, right? And I think we encourage both, the different medication strategies, but also the other things that you can do along with your medications. And I think that's why we really say it's a complement to the care you're already receiving.
Excellent. Those are really good points. Kind of piggybacking on what you just said about a complement to your medication. We get a lot of questions that in regards to, can any CAM therapy lessen the need for medication, or is it just truly complementary?
I would say again.
Yeah, go ahead.
For it. No, after you, please.
I was just going to say, there are definitely medications we need for treatments of certain things. I will say, when it comes to pain medications, I think it can be a really helpful adjunct. And there have been studies that have shown when we do some of these other stress relieving breathing, acupuncture, aromatherapy, that it could lessen the amount of pain medications you need or how often. And so that's why I think they just go so well together.
Very much so. I mean, when we look at it from a research standpoint, we'll often conduct research studies to say, is this intervention opioid sparing? So basically, if I have a kid in the hospital and I do this for this amount of kids and do this for these kids, which one uses less oxycodone, as an example? So that's a great way that we would say, again, I'm not giving you this so that you can stop your methotrexate necessarily, but I'm going to give you this, and maybe you won't need as many pain meds as Bethany was just articulating. And it works very well for that. And I've seen that. I think sometimes too, it's helpful for us and families to be advocates for it, because I've taken care of kids in the hospital. We had a kid who was pre-heart transplant, who had bad heart failure and bad headache. And everybody assumed that it was all, oh, it must be the heart failure causing headache. And I did acupuncture on him on his hospital day 3. And he's like, hey, my headache's gone. I want to go home. So it's like, there we go. So that was a nice way of saying that's a non-medication approach that actually can help kids feel better. So I, again, think it's great to reduce the burden of the interventions and the medications, especially those as needed pain meds, but we wouldn't use it to replace a therapy that we know is beneficial for a child.
Wonderful. Great answer. We have a question that just came in. It says, you mentioned chiropractic care as an option. Are there any concerns with adjustments in JA patients, and what considerations and questions should be asked before considering it as an option?
Excellent question. You want to make sure, first off, just be straight up with the chiropractor. Try to get good reviews. Try to use a network, whether it's a Facebook group or some of the other JA groups. Say like, hey, who in Cleveland is comfortable working with JA patients? And then directly, if you do decide to try to seek chiropractic care, ask that person. You should ask your primary team, do you have any opposition to my child using chiropractic care? Because they might say like, yeah, your bone density is too low. I don't want you to actually do that. Or they said, no, please, by all means. But if that is cleared and you see a chiropractor, I would ask them, are you comfortable treating my child with juvenile arthritis? Make sure that they know that that's why you're there, so that there's at least that baseline. And then also the person should pass the sniff test. Most chiropractors are fantastic, but if all of a sudden you get somebody who's saying like, oh, actually, I can treat your child with these fancy vitamins that cost $500 a month that only I can sell them to you. You're like, okay, I'm going to leave now. But yeah, I would definitely say if you're looking at that as a potential, ask your treatment team first, make sure that they have no reservations, ask the chiropractor themselves if they are comfortable working with that, and just use the resources of your local groups. Be like, hey, anybody know of anybody who's been working on children in this area?
That's great advice. Thank you. What about insurance coverage? Do you know if any of these therapies like acupuncture, chiropractic care, does that really just depend on your plan, or is there any way that we can make these therapies more affordable for our families?
From what I understand, you would just have to know what your plan allows. A lot of plans do allow acupuncture at this point. They kind of treat it like they do PT. You're allowed 12 sessions per year. I get around that a little bit because I'm a physician providing the acupuncture, but if you were to go to an LAC, a licensed acupuncturist, that might still have to be the benefit. So you would really have to just check with your insurance carrier as to what they do allow. A lot of places though may have sliding schedules based on family income. Like there are a few massage therapy places that will basically say, hey, what's your income? And they'll say, like, we normally charge $100 an hour, but we'll charge $30 for your session, as an example. So sometimes it's just being open with that. And then if your child is on a community directed waiver, sometimes you could check to see if those dollars could also be used for some of these alternative therapies if they're not covered by your insurance company, is what I would recommend. Bethany, other insights from your direction?
No, I think that's great. I do think many places, especially in pediatrics, have a sliding scale system. And I'll just echo again, same thing. If you're on some sort of waiver, you can usually allocate dollars, at least towards massage and acupuncture are covered usually.
Excellent. This next question is for you, Bethany. It involves the safety risks of essential oils. You mentioned inhalation, but we've had some parents ask about using it topically. Is there any safety risks, anything that you would be wary of when you're using essential oils, and any tips on finding a good essential oil?
Yeah, so I think with essential oils, especially when you're using it topically, almost all essential oils are diluted in something. And so it's important to note what it's diluted in. An example is that our oils at Children's Minnesota are diluted in jojoba oil, which is generally safe and tolerated well on the skin. And so you want to make sure it's something that is skin sensitive. You also could start with just doing a very small, I would strongly suggest, with just doing a very small test patch on the skin. Essentially the size of a fingerprint, keeping it on there for a while and making sure there's no reactions, and then placing it on. Again, same as Scott said with acupuncture, you don't want to do that over open wounds or burns, intact skin, and always start small. But in general, essential oils can be very safe and tolerable on the skin.
Wonderful. This question's for you, Scott. How do you find with acupuncture, is there anything that you need to look for in an acupuncturist? I know you mentioned a licensed acupuncturist. How can somebody go about finding a qualified acupuncturist for their child?
Excellent question. Same thing, check with your networks to say like, hey, anybody out there know of a good acupuncturist over here, in Seattle? Another great resource are our chiropractors. So if you know of a reputable chiropractor, or you know of one that you personally have used or are compatible with, ask them. They'll have often affiliated LACs with them, but you definitely want to make sure it's an LAC. And you also want to just gauge, again, their comfort level in working with children and working with children with JA. To be just like, hey, are you comfortable with this? Do you have experience with this before you were to go in there cold? Because there are many approaches that we use in acupuncture with children that are different for adults, as well as some of the different tools. Like we have different types of needles, and we have like little press-on stickers with little nubbins on them that are not even actually needle. So those are ways that we work for younger children as well. So I would say, if you really have no other place to go and you just need a starting point, try to find a reputable chiropractor in your neck of the woods and ask them if they have an LAC or if they know of anybody that they would recommend. And then, like I said, make sure you bring the questions to them before you take your child in and just say, are you comfortable with this? That's what I would say. We do have the American Academy of Medical Acupuncture tries to maintain a list of certified medical acupuncturists in the area. It's a small list though, so it's by no means going to be helpful for all areas.
Excellent. This question's for you, Bethany. How do you get and I know you shared some wonderful apps and tips, but do you have any additional tips on getting an antsy child to do these breathing exercises and meditation? Do you incentivize it? Do you, you say you can, I don't know, maybe we'll go out for ice cream afterwards? I'm taking the words out of my mouth.
So I think one great way to do it is simply by doing it together, doing it as a whole family, or honestly just making it part of your day. Like when we get in bed tonight, we're going to take 5 deep breaths all together. And I would strongly say not doing it again, even minutes can be too much sometimes. If you have a toddler, young children, sometimes 5 breaths is enough. Doing that throughout the day, or doing it in times when maybe you're driving to an appointment or driving to school or walking to the bus stop, and finding those moments. I would say you could incentivize it. I think that can be tricky sometimes, but maybe more in finding simple moments and focusing on, 5 now or 5 here when we first wake up, and just making it a typical part of your day, part of a routine.
I love that advice. That's really great. I think that we've already answered all the questions. Is there anything that you both would like to add as any final talking points or take-home points before we wrap up the session?
I would just say thank you again for your interest in this topic. I think it's great. And I would definitely say, please just ask your healthcare team about this, because it can provide a wonderful wealth of resources for you and your child to focus on a variety of issues to maintain that health and well-being.
Yeah, thank you again for having us, and please don't hesitate to reach out with any questions following this.
It was our pleasure. Thank you so much for joining us today. And see you later, everybody, for the next session.
Thanks, guys.
Bye.
Bye.
Bye, take care.
So thank you, Scott and Bethany, for being with us today and sharing your expertise, and to Robin for moderating. It means so much to us. Thank you to our attendees for joining us for our breakout session. Please take a moment to provide feedback on your session by completing the conference survey in the app. This will help us guide programming in the future. Be sure to come back for our closing general session, which is at 3:30 Eastern Time. You can find the Zoom link for the general session in the conference app, and be sure to check the conference app for Arthritis Foundation resources. And I encourage you to take part in the JA Insights Today. Access is in the link in the app.